Congratulations for carrying on with your pregnancy up to the third trimester. You're literally thinking of how labor will be. How long will it take? How will you know that there are true or false signs of labor? And when will it come? Actually, in this video today, I'm going to take you through the pre-labor signs, the signs and symptoms you'll experience few days or weeks before going into real labor, and the actual labor signs and symptoms. Welcome to the Nursing Moms. If you like our videos, hit the like button and subscribe. Stay updated for more coming videos by hitting the notification bell. The pre-labor signs and symptoms. While approaching your baby's birthday, there are several noticeable changes that will occur to your body in preparedness to the delivery of your baby. These changes can occur weeks or even days before the onset of labor. One of them is leaking breast. Hormone prolactin ensures that before the birth of your baby, there's something in store for him or her. Colostrum is a highly nutritious fluid that leaks from your breast few days or even weeks to the delivery of your baby. Baby drops. Medically, it's called lightening, and in this, it can be seen outwardly, or you can as well feel it by feeling a big relief on how you're breathing. If at all you had problem in breathing previously, the baby's head tried to descend downwards into your pelvis, creating more room on your diaphragm and the lungs. This can occur between 2 weeks or even days before the delivery day. Increased urge to urinate. The pressure created by the baby's head on the pelvic region will be pressing on the bladder, and this will make you to feel like going to pee most of the time during the night and during the day. The mucus plug passes. During pregnancy, there's a thick mucus plug that covers the cervix to avoid it opening. In the third trimester, few weeks or days before the onset of labor, this plug can pass in bits or as a whole. In some women, it can pass on the day of labor. Contractions. In the third trimester, especially few weeks or days to the onset of labor, there's a typical type of contractions known as the Braxton hicks contractions or forced labor contractions that a woman can experience. These type of contractions are irregular, and the pain can be relieved by light activities like walking or even changing position. That is what makes the difference between these contractions and the true labor contractions. Burst of energy. This usually occurs a few days to your labor day. Around this time, you'll feel you're really energetic and would feel you have that urgency to get things done. Around this time, a mother prepares the baby's room. You'd want to wash your baby's clothes, but again, you have to be very careful and conserve energy. Don't overwork yourself, just conserve energy for the labor. Loose feeling joints. In your last trimester, especially few days or weeks to the labor day, you'll have that feeling that you can easily fall, or you're feeling your joints are a bit loose. This occurs due to the hormone relaxin that is there to relax the pelvic joints and ligaments in order to accommodate the descending baby. It also has effects on the general body joints, and that is why you'll feel this kind of looseness in your joints. Loose bowel or diarrhea. Some women may experience diarrhea a few days or even on the labor day. This occurs due to the hormone relaxing all the muscles in your body, including the rectal muscles. Bloody show. The thinning and dilating cervix creates a room for the passage of mucoid blood-stained discharge through the vagina. Actually, during pregnancy, the cervix was covered by this mucoid plug, but now it's opening and creating a room for its passage. Contractions. Labor contractions are regular and frequent in nature. They last for about 10 to 70 seconds, and they come between 10 to 5 minutes apart. The labor contractions are strong and they increase in frequency. That is, if you are getting a contraction after every 8 minutes, then as time goes by, as you approach your second stage, you'll realize you're getting it after every even 3 minutes or even 5 minutes. That is what makes the difference between this contraction and the Braxton Hicks contraction. The labor contraction also are so intense that during contraction, you can neither talk nor walk. Actually, you have to get relieved fast. During this contraction, if you observe the abdomen, you will see it tight. What happens during contractions is that the muscles of the uterus tightens up like a fist and then relax. It's these contractions that will lead to pushing the baby out. Dilatation of the cervix. The thin and soft cervix will dilate progressively from the latent to the active phase of labor. Every 4 hours, you'll realize your health worker will be doing a vaginal examination actually to determine how far the cervix has dilated. When it's fully dilated, that is up to 10 centimeters, it's when it can allow the passage of the baby. Lower abdominal and back pain. The labor contractions always bring a dull ache on the lower abdomen that always radiates to the back. Actually, it's also brought by the increased pressure on the pelvic region can lead to this kind of pain and discomfort. Water breaking. The hormones, enzymes, and pressure involved will loosen the amniotic sac, making it to break spontaneously, leading to fluid flowing down from your vagina. That is the amniotic fluid. Again, you'll have to check the color of this amniotic fluid because it will indicate whether the baby is okay or is in distress. This can occur anytime within the 24 hours during labor. There's no specific or marked time that these signs and symptoms can occur during labor. And again, not every woman could experience these signs and symptoms as each and every pregnancy varies from woman to woman, and again, each and every labor can vary. This labor might be different from your previous labor. Knowing these signs and symptoms can help you make an informed choice on when to go to the hospital.